FH.
I see Jan Marie's on.
Beth, if would you be able to look at the attendees and if Jan
I,
Marie, oh, there she is. I
yeah.
found her. Let me promote her to panelist. All right. I think we can get started now. Okay, well, hello everybody and welcome to our webinar on measuring change. This webinar is called Prioritizing Community and Evaluations. Um, Before we get started, we want to do a land acknowledgement. So Seattle is located on the ancestral lands of the coastal Salish people, where the Foundation for Healthcare Quality is located. And I'm coming to you today from New York City, actually, which is located on the ancestral lands of the Lenape people. And the foundation would just really like to recognize that this land was cared for and stewarded by these people for generations before our arrival, and that we honor their continued connection to this place. So a few little bits of housekeeping before we get started. You're welcome to drop any questions into the chat box and we'll answer them at the end of the webinar. And just to let everybody know that this webinar is being recorded. So today we are joined by two wonderful people, Jan Marie Ward, who is from the Chumash and is a descendant of the Santa Ynez and Barbarino, California Mission Indians. She's a public health strategist who's focused on whole health and well-being of American Indians and Alaska Natives. And she's going to be chatting with us today about their framework for evaluation called Pulling Together for Wellness. And our other speaker is Martha Landman. Martha is a Garfield County Public Health Administrator, and she brings 19 years of public health experience to her work every day. She partners with numerous community organizations to promote the well-being of Garfield County and of the Garfield County community, excuse me. And today she's going to be talking about how Garfield County communicates evaluation findings to address community priorities. So today I wanted to start by inviting Jan Marie to share her screen and start off our conversation.
Thank you for the introduction and the invitation. I'm so glad to be joining you all. And as I get my screen set up to share, I'm just asking for your patience here.
Did you find it okay, Jan Marie?
I am. Do you see it?
Yep, there we go.
And is it in the right mode? That's
Yes.
always the question. Oh,
Yeah.
great. Okay. Um, So I'm here to share with you today, on behalf of the American Indian Health Commission, the Pulling Together for Wellness framework. It's a tribally driven framework developed through the leadership of the tribes here in Washington State. We talk about this as our path to healing and resilience. It is important that we start at this point. I'm going to go as quickly as I can through a lot of slides. Um, I've lived in the Pacific Northwest on the tribal lands of the Nisqually and Squaxin Island people for several decades. I have many close relationships here, some of which I consider my extended family. I'm a mother of four sons and a grandmother. My granddaughter is Jayla Okosh. Okosh is Otter and Chumash. I dedicate my work and my efforts to her generation, our next generations and their future. For many years, I've promoted culturally relevant models and strategic thinking rooted in health equity in a public health context. And I'm honored to facilitate and be a steward of the development and implementation of the Pulling Together for Wellness framework, along with the Tribal and Urban Indian Leadership Advisory Council that I've been working with for, oh gosh, quite a long time as well. And in addressing health equities and the integration of strategic planning. Early inspiration for this work on a personal level has come from Connie McLeod, one of the elders from the Puyallup tribe, um, Billy Frank, national leader, passed on now, and his wife, Sue Crystal, who was formerly in state government, also, she has passed on. The culture, and that's where we're going to start, is culture in our minds is prevention. Not all people have the same historic background or cultural understandings and background, and that we accept that there's more in one than one culture, and just knowing that acceptance is the opposite of oppression. This is important in acknowledging up front in the work that we do with tribes, and we really stress that culture, from our perspective, is prevention, and community is our medicine for the health of all of our relations. It's a challenge to fit Indigenous philosophy and cultural practices and protocols into Western frameworks. This is a quote from Vine Deloria, who is very well known throughout Indian country for his leadership and for his scholarship. He's written many books, God is Read, and anyway, a long list of publications that he has, and I'm glad to share that with you at a later time. But here he's saying, that there's little attention to develop Indian methodologies for gathering data, and therefore that this has been done in a very ad hoc way, because there's not been a lot of effort in creating frameworks that are effective in Indian country. This is the Pulling Together for Wellness framework. It's a comprehensive, tribally driven, and culturally grounded prevention framework, again, developed through the guidance of tribal leaders here in the state, and it is evidence informed. It was co-facilitated with the council and also through input from cultural knowledge keepers, youth, elders, students, in many forums throughout Indian country, at the local tribal level, community level, state, regional, and tribal venues. Another one of my mentors, Greg Cayete, who is also well published for his work in Native science. And I won't read the quote to you, but I think that you can read it on your own. But the emphasis really is that Native science is based upon a relational analysis versus a single point of analysis. And that's really important in our work in public health, in the way that we make those comparisons in the way that is most effective for our population. Another image and quote here from Vine Deloria. The primary difference between Western and Indigenous ways of life is that Indians experience and relate to a living universe, whereas Western people reduce all things, living or not, to objects. So again, that's just another way of sharing really what Gray Cayete's point was. Also, recently, the Yurok tribe passed a resolution granting the Klamath River the legal rights of a person, the rights of personhood. And this is in that context of all of our relations, that our relationships with the plants and the animals and the waterways are all important to whole health, holistic health, that our view is not from a hierarchical framework. Other tribes have done similar things. Anasabi has also passed a resolution giving the wild rice the rights of personhood. Here is the framework, and in our short amount of time, I'm going to do the best that I can and to giving you um, some elements of understanding here. Just to note that this work started as part of our tobacco prevention work. Tobacco from a native perspective has a history of being a powerful medicine. And our stories, our origin stories, many of them go back to tobacco as medicine. And when we started working with the state in this work, they believe that there were like 10 strategies that CDC had outlined for to choose to focus on in the policy systems and environmental change approach. And so we had a first gathering, and at that meeting, tribal leaders showed up, and they were not necessarily the focus of our invitation, but there were a number of tribal leaders showed up, and what they said right away is that it's not just about tobacco, it's about emotional wellness. And so the concepts of coping and and many other issues were talked about that day. And so I was asked to walk backwards, step backwards, and think about how we could do this in a different way that would be most effective um, for the tribes. And so that led to the development of this framework. They were clear in this thinking about the connection to emotional wellness as part of our holistic health. And our approach here has been to address historical and intergenerational trauma, and ACEs is a foundation to understanding root causes, many of which has been associated to behaviors linked to unhealthy coping behaviors or diseases of despair. The use you'll see here in the center is the medicine wheel. The medicine wheel did not originate in the Pacific Northwest, but the teachings from the medicine wheel are well known and resonate throughout Indian country. The medicine wheel is a symbol of our memory of what was, and that our physical, mental, emotional, and spiritual health are all interrelated. Culture, you see, is positioned in the center as the central component that's interwoven in all aspects of our health. Again, culture is medicine. The medicine wheel also is used to reflect that balance and relationship to obtaining whole health. And again, that symbol of our memory. Populations, indigenous people, have been in crisis for decades due to the prevalence and rates of chronic disease and health risks and the effects of unresolved grief. Chronic disease rates and social determinants of health have long been associated with risky behaviors. CDC and other agencies have shaped their interventions based upon this thinking, knowing, and I should say historically, because there is change in that thinking as well. Knowing and understanding the science and the stories is important to developing deep understanding of the roots to disproportional health experience and today's health disparities, and the complexity of their causes within our populations. We have learned over the course of this work that also strength-based understanding centered from within community and relying on cultural and ancestral experience and wisdom is crucial to restoring our health. Evidence-based methods, commonly understood by agencies and institutions in public health practice, much of the time do not reflect this thinking. The distinction of our work has been to call out the importance of tribal and community-centered understandings demonstrated through our engagement principles and strategies that are incorporated into the framework. It's a holistic approach to health. We also use the culturally grounded seventh generation thinking in the development of policy systems and environmental change. You can see down below in the image that there's generational clarity. And when we were developing this framework, these are the issues that came up that were, external to what we were initially talking about, the tobacco prevention efforts. But these were the emerging issues at the time, some of them, like around the adverse childhood experiences and the work that was being done at that particular time. But we knew that we needed to come back to this because it was clear that this is part of our healing work. And in order to obtain this holistic health, that we had to address the issues of healing. This is what is the definition, vision, and values that were developed through the Leadership Council. And these statements are visions, statements are our goals, and not just aspirational, but operational. And they acknowledge the importance of a life course approach. And we actually use the term seven generation philosophy instead of life course. Our life course is beyond cradle to grave. It's generational. And in the vision statements, they flow from first our that our babies and our moms, mothers, and fathers are healthy and supported, and then carry it on through, generationally, our youth, our elders, our families, and then on into communities, and then our people in terms of the social determinants issues, and then in terms of our environment, and then our policies. And then our values are things like based on we acknowledge tribal sovereignty and self-identity are the highest principles, and then those go on. And they're all integrated into the framework. There are 20 competency areas. And for example, the first is understanding components of the framework, including the development, implementation of action planning processes, strategies, methods. And then knowledge of tribal sovereignty, treaty rights, trust responsibility, government to government relations, and tribal jurisdiction. It goes on. The generational clarity, and that is that healing work that I mentioned a couple of slides ago. And I'll talk a little bit more about that in a few minutes. And again, it goes on. And then understanding Indigenous data collection methods, the ability to interpret, analyze, and decolonize data reported by government, private, nonprofit organizations. And then there's some language about ability in development of community health assessments and scans. And again, that goes on. The next area is about specific strategies that are culturally appropriate strategies to really address some of the public health issues, and then the ability to sustain those partnerships and that are important to be able to have work that's continuous, and on down to supporting the development of storytelling skills reflecting the auditory traditions of tribes. Clearly, I know that that's not going into that in detail, but it gives you at least a flavor of what those core competencies are. You'll see a lot of similarity in some of the evidence-based public health approaches, and that was intentional. This work is informed by the standard public health, but it is shaped and developed through the lens of tribal leaders and from an Indigenous perspective. Here, I think one of the things that I want to make certain to mention is that this process honors tribal sovereignty and familial relationships. In tribes, of course, there's a lot of we're connected through bloodlines. There's a lot of family that is involved in whatever work is happening on the tribal level. And so that is important just to recognize, and then also just having that perspective of all of my relations. Through this process, it became clear in the beginning when we started talking about who should be involved at the initial stages, how should we continuously engage with community. It was clear again from the tribal leaders' perspective that because of the extractive nature that research has had in Indian country, that it was important that that there's a strategy to continuously tell the story and come back, not just be there to at the beginning of the project, but to come back and engage community members in the process. This is an opportunity just to talk a little about the concept of 7 generations. And this is really about how we walk in the world, that our stories are a living part of our lives. That goes to the importance of traditional stories, original stories that kind of lay out some of the important elements of our own cultures and protocols. And this thinking is based also on that we carry the stories of our ancestors with us and that they guide us. They guide us in current context. We think about our current challenges and the issues that our ancestors have managed and lived through and their experiences, also their wisdom, and bring that forward into the current context to lay out that pathway for those next generations. And you can see here that we're putting this in again in this framework of there's where our vision and goal statements are in that one document of where we want to be. And then indicators of where we currently are, and then thinking through this 7 generation approach that creates that long-term vision. And long-term, I really mean long-term, and especially with respect to evaluation, that it's important to recognize that the timing, and I'll share that in just a few more minutes. Just the timing is important when you're working with tribes, that we have to operate from their set of priorities and their needs. This is actually an image of Charlene Nelson, former chair of the Shawater Bay Tribe. She was very involved and championed this work for quite a long time. She's no longer the chair. She just stepped down, I think, about a year or so ago. But this is, again, just that sense of, what do we need to know in order to make decisions aligned with setting out goals and working on these planning processes that many times we're challenged with having accurate data, and for a lot of reasons that we don't have time to go into today. But it is important that we get the best data available and that we work with that data, that we also, it's important to place importance on the capturing the history and experience of the Indigenous people that are in in this process that this work is relevant to, and also the cultural needs and practices. Okay, defining and cultivating authentic partnerships. Um, First of all, having respect and honoring tribal sovereignty and all of the steps that are taken. Certainly, I have many stories in the past where organizations will go in and contact a project manager and want to do some work with a tribe, but they have not really gotten approval from their government. And so tribes are sovereign nations, they're governments, and it's important to follow their protocols. Many tribes will not, that you have to have prior authorization to come in, but all tribes are different, and that's really important to understand. Um, Understand the historical relationships that have been there. I remember once that it was the Klallam tribe. There was a woman that lived in the community external to the tribe that had asked me, was there something that happened here? It's just that there's really weird dynamic between some of the native people and here and the general population. And yes, there was a dynamic. They were terminated in the 50s, and it was they were very successful. They had a very successful timber industry, and that certainly impacted their ability to be self-sufficient. Get familiar with the systems, culture, and norms unique to tribes and urban Indian communities. Understand the importance of supporting tribally led frameworks, goals, needs, and solutions. Really, and we're hearing this from lots of other communities, don't do anything about us without us. And that's always been true in Indian country. Appreciate the complexity of the political environment. And I spoke to that just briefly a moment ago. It is important to recognize that tribes are sovereign nations. And what does that mean? And really getting to understand that from not just a theoretical understanding, but an operational understanding. What does that mean for our organization to work with sovereign nations? Understand the different levels of engagement and appropriate protocols. Again, do we have authorization to do this work with this program? And also recognize that all tribes are different. Be clear about your organization's role. You're bringing in technical expertise. Tribes know what's best for their own communities, but there are ways to support tribes, certainly. Respect and honor data sovereignty, tribal ownership of information and data. And this is really a very important, and it's getting a lot of um, emphasis right now in all of the work that we're doing. Love to share that work with you at some other point that is having to do with maternal mortality and pregnancy risk assessment monitoring, system surveillance. Support tribally driven processes and timelines based upon tribal needs and priorities. That couldn't be emphasized enough. And that gets, there's many tribes, if there's a death in the community, they'll shut down. And people outside of tribal experience don't really quite understand how that happens. It can shut down for several days. I wanted to just share this slide with you, and I'll share the link to the video, but Billy Frank does this incredible job that really talks about giving context to some of the things that I've shared with you this morning. And I love this quote: I want respect for my people. I want respect for our culture. I want respect for our natural resources. And natural resources, Billy would always tell me, just remember the salmon, because they're an indicator species, and whatever happens to the salmon will happen to us. And just remember that in your health work. And I always have, and I really appreciated that. This is our generational clarity, and I probably have just enough time to read this to you, and I'm going to do that. Generational clarity is an acknowledgement of our stories from our voices. It centers us on healing our hearts, minds, bodies, and spirits from the effects of injustices experienced from historical trauma, ongoing racism, and discrimination. And generational clarity is acknowledgement of the existence of cultural narratives, practices, traditions, stories that inspire reflection and renewed understanding of our inherent strengths and resilience that have sustained us since time immemorial. The importance here is that these stories really have to be told from our own voices. And I know that, there are many experts, anthropologists that have done, incredible work over time, but really the true stories come from the original people. Um, and with that, I really do thank you for your time and thank you for the invitation. I appreciate it. I know that we didn't get into the detail of a evaluation specific, but I think that this is really important to give context to how evaluations, what you need to understand before you even step into that world. Thank you,
Thank you,
Carrie.
Jen. Yeah, thank you. That was really, your slides are lovely, by the way.
Thank you.
Um, as we transition here, I'm going to share my screen and run Martha's slides. And I would just like to let you guys know that we will be following up with this webinar. So if there's more information, we'll have contacts as well at the end that you can contact Jean Marie and contact us to talk more about this. So let me just getting my slides back up here. Here we go. And I would like to invite Martha to come off of mute. Martha, feel free to let me know when you need your slides advanced.
Thank you. Thank you. I'm glad to be here today. I'm Martha Landman from Garfield County Public Health District. I would like to thank Bree Collaborative and Jack Davies for inviting me to share our information about our community health assessment and how we reach out to the community and have evaluated that. We've changed our process over the last couple of years and excited to share that with you today. A little bit about Garfield County. We are the smallest county in southeast part of the state, about 2,300 residents with 25% of our population over 65, another 10% in 18 to 65 in disability, and 22% in 18 and under. So we have almost an equal amount over 65 and 18 and under. We only have one city in the county, a city of Pomeroy, Washington, and we're about 35 miles from the Idaho border. So close there. We have a hospital, we have school, we have all our county government offices with our main occupation in our community revolving around our agricultural community. This gives you some sense of our community as we discuss the health and the community health assessment and what we've been working on over the last couple of years. So go ahead and go to the next slide. So in 2018, there was a community health assessment done, and it was really more of a quantitative community health assessment. So we went and got information from DOH. We went and got information from demographics in different places, the census and things like that, to be able to do our 2018 assessment. As things rolled through the next couple of years, I also started this position as Garfield County Administrator in 2018. And as we rolled through COVID and things like that. It just looked like it felt like the community was starting to look different, and we wanted to really have more community input into our community health assessment, and really work more on qualitative data. I always get those confused. Qualitative data meaning, hey, I want to listen to the community. I want to listen to the community voices. I really want to know what the community's thinking about our assessment, not just quantitative data. So that was, so in 2023, we let out a community health assessment that we focused on that. So let's go to the next slide. So really, we hired Heidi Bertude, consulting firm that works on data and assessments across our state, and brought the process to us between March and June of 2023, and really put together what I felt like was a combine. We did a survey, really had good response from our survey, 403 responses, 18% of our community. The other interesting thing about our survey responses is 30% were male, 66% female in our responses. So usually male responses are really low, but we really made a concerted effort to go out into our community, go to board meetings, go to staff meetings, go to our local nonprofit groups meetings, and tell them about our survey and ask them if they would help us in our community, and really got good response out of that. We presented at the senior center, the food bank, the local nonprofit event group, and promoted the survey online, and asked for all of our local Facebook pages to share that. And then with Heidi reached out as a independent person outside of our community. She reached out and did some key leader interviews. So it was coming, while we helped with the survey questions and the interview questions, it was really felt like we had success with a nonpartisan or person outside of our community being able to ask the questions to our community members to just get the feedback that we needed. And then we did 4 focus groups around our community, invited people from different areas, so that it wasn't all the school employees at one. Everybody was different in each focus group. We really had a diverse number of people in each focus group. We didn't separate it out by job or by healthcare or anything like that. We mixed everybody together, and I think that really brought a good conversation in the focus groups to just really talk about overall what they saw we needed in the community. Okay, next slide. So this is just talking about how we did it. It looks different in our community evolutions from 2018. We wanted the real stories. We wanted the lived experiences and the community voices. It was just so important, community, as we were doing this health assessment. Next slide. We'll see some results. So this is a lot on this slide, so we'll just take a minute and absorb from the left to the right. Really, as we got the results of our survey in 2023, our community strengths were low crime, clean environment, outdoor recreation, being able to have Umatilla National Forest on one side of our county, on the south side of our county. So we have hunting and outdoor recreation and hiking and all those things available to us. And then on the north side of our border is the Snake River. So we have all the fishing and outdoor activities that are available there. So that outdoor recreation really came in high on our community as a community strength. Our community gaps are childcare. We have no licensed childcare, no home childcare, no licensed childcare period in Garfield County. So a typical scenario for somebody with childcare is they'll drive 35 miles to Asotin County, Clarkston, Washington, or Lewiston, Idaho, and drop their kid off in the morning at a licensed childcare, and then they'll drive the 35 miles over a minor pass to pick up their child in the afternoon, and then have to allow for doctor's appointments and sick kids at 11 o'clock in the morning and things like that go with childcare. Would go with your child. So really felt like that came in number one on the survey as needing childcare in our community. We have about 380 students in our school. That's all the way through kindergarten. We also do TK, so 4-year-olds and up to 12th grade. So we have over 25 kids usually in each class, and so that gives us an idea of what our childcare needs are from the ones that are younger than 4 or 5 years old. Mental health, while we have human services in our community and some mental health services connected to our human service division, we didn't have a licensed mental health MSW in our community. I have been born and raised in Pomeroy and have left for a number of years and come back and can't remember ever a mental health licensed MSW in our community. And I'll tell you some results of that in a minute. And then housing access, just not having housing, not being able to get housing, having empty houses in our community owned by generations that might not be willing to give up the house, but no longer living in our community. And then our barriers, provider turnover. So we have a hospital and a clinic, and our clinic physician would come for 2 or 3 years, and then they would turn over into another provider. Not a lot of patients, or maybe not. There's many different reasons they think that they want to live in a small community, and many different reasons that they leave a small community. And then community communication and stigma and pride came up as just, oh, you haven't lived here your whole life, or you're not from Pomeroy if you're not on your 3rd generation of names in Pomeroy. And so just really working on that and really reaching out to our new people in our community and being more involved and making them feel more involved in our community. So the 3 top out of what's here on the left-hand side, the 3 top ones that public health thought they could make a difference in. And these are the questions we ask ourselves when we were talking about it. We were like, hey, how does it fit into Garfield County Public Health organizational capacity? Is there a way we can make a difference? Is there existing infrastructure in place to support it? Is there established relationships between public health and the hospital, public health and housing, public health and mental health, other entities in our community that we can work together to make a difference? And then is there an ongoing investment? So the 3 that we chose is childcare because it came up as the top need to be able to do something in that. And I'll kind of give you results of where we are. We're in year 3 right now, but I'll give you results as we're going here, just so you have an idea of where we are. So this was in 2023, and here in 2025, we are working on a childcare. We have public health has hired a childcare navigator, we needed somebody to drive the bus. We have a lot of community interest. We have a lot of community support, but we didn't have anybody that had enough time to put all the pieces together and understand all the pieces that we needed to have a licensed childcare in our community. Once we got a child navigator on board, we were lucky, just fortunate in our community. Our community heard about it, and a community entity said, you know, we're not using our building like we used to. We're thinking about donating the building. How would the childcare, how could we do that with the childcare? So we quickly set up not quickly, it took a year to set up a nonprofit that would be focused on the childcare. And when I talk about the nonprofit, it shows community because we have the mayor on the board of this new nonprofit just working on childcare right now. We have a person from the school, the financial officer from the school. We have a community member. We have a person that works at the county. And then us at Public Health are on that board, a member of Public Health, just bringing different community members together and saying, hey, would you like to help us with this, has been really important. So right now we're in the process of working on, or have completed their early learning facility grant on renovating the building that would, with the possibility of housing 45 kids with some renovations to the building. So excited to get the building and have it as our first step. And now we're just moving along in the last 2 years. Mental health advancements that we've made in 2 years is we've actually got a licensed MSW private company to open their offices in Pomeroy. They are now also expanding and have hired a couple of new employees because of the expansion and the training and the clients that she has, that they need more MSWs to help the clientele. So huge benefit to our community to have an additional MSW and office and business in our community. She also provided with public health support, children's mental health classes all through her first 6 months, 9 months of being in business on a weekly basis. So all the kids could go to some kind of mental health support classes for free. And again, just wanting to be a community member, wanting to help our school and see what the needs are. And then our third place is community engagement. We're like, we don't know when the activities are happening at the school. Somebody has a fundraiser. We don't know when. I didn't know cornhole was happening at one of our halls in our community. I didn't know when the Chamber of Commerce meeting was. These are the responses we got when we did our assessment. So we have built a community calendar and released that out into our community, and it has different sections on it, a section for the churches and what activities are going on at the churches, a section for what's going on at the schools, a section for what's just going on in our community and people are doing and our nonprofits and what they're doing in our community, and a calendar that anybody can go and look at. We have a couple of different admins that add things to it on a weekly basis. Just trying to get everything in one place as much as possible. And people seem to really enjoy. You can get it through the web, you can get it on your phone, and you can look at it real quick and see what's going on at the school or what's going on in our community. And so that's been quite an endeavor to get that up and running, but we're hearing good things about that as it continues to grow in our community. Next slide. And this is kind of just where we are and where we're going. Our goal was to do the community health assessment in 2023 and then just have a 3 to 5 year plan on a community health improvement plan. We go back out to our community once a year, and we have done it in different times of the year in case that we're running into the farming community and they can't come. But we go and do what we're calling a data walk or a community progress report out to our community on 3 different occasions every year. and just share with them what I just shared with you. Hey, this is where we were in 2023. This is where we are in 2025 with the childcare. This is where we are with community relations. Do you see anything different? Get their feedback of what they're seeing in the community. Should we be working on something else? Things change in 2 years. Things change in 3 years. Is there something else that is an emergent need as we bring the community in and listen to them and just help them reassess what we're doing. We also do update our quantitative data, our housing numbers, our numerous other numbers that we're watching in these data walks, so people know if has the housing thing changed, has the safety aspect in our community changed. We're trying to give them just a year, at least a yearly update, and still doing some interviews on a year-to-year basis just to get a feel for the community and make sure we're involved in the community and listening to them, not just taking our public health vision of this. So really happy to be doing this, really happy to being able to have someone guide us through this community health improvement plan process in our community. And we're starting year 26, and we will kind of see what that goes like, what the things look like. 2027 adjust, and then 2028 start all over with a new community health assessment. So a process to get our information and evaluate it back out to the community and continue to listen to the community as we go along. Okay, and I think that's the last slide I have. One more.
There it is. Yes.
Just my information in case you want to reach out to public health and ask any questions or any of our processes or anything like that. Happy to answer all that.
Great. Thank you, Martha. And I will stop sharing this for just a minute. I'm going to, Martha, I'm going to unspotlight you.
Thank you.
And bring everybody back on to the screen for just a minute here. So as we wrap up, like one of the things that I really heard from both of you guys is that context matters, no matter what you're measuring in terms of health. I think that the context in which that person lives, we would typically call those social determinants of health. I think that rural and tribal communities seem to me to really focus on those more than maybe traditional public health. And I just wonder if you could leave us with any last thoughts on that.
I think on my side, community is so important. I don't think you can say it enough that community relations and building community relations, not even from the public health aspect, but from the non-profit aspect, from the health hospital aspect of knowing the people in your community, from the county aspect of knowing your community, just all those people working together and having and talking to each other really is a benefit to the outcomes in your community.
I agree with Martha very much in her comments. And then what I'll add is that what we are now calling holistic engagement is really important, right? I mean, there's been a lot of effort in reaching the youth lately. This is like post-COVID, right? There's been a lot of effort. And so we're seeing that, in all various different types of work, but certainly within public health. I think that it's really important to also just know that that when working with tribes, they're sovereign nations, and that our public health people don't have a lot of practice in understanding what it means to work with tribes in that capacity. They think of them as other public health organizations or as communities, but they're sovereign nations. And so there's more effort that is necessary to understand the government structure and protocols for those specific governments that you're working with. And this is particularly important in, well, in all areas, but I'm just thinking about in emergency management, public health emergency management, and preparedness and response. And so, there's where you get sort of the critical nature of that. So I'll say that much. And then I guess the concept of making certain that we're reaching at the community level in all different areas. So that means that expansive age group, not only the youth, but also the elders.
Thank you so much, Jan Marie. Now, I didn't see any questions in the Q&A or the chat, but I would invite all of our audience members to contact us. I'm going to put up a little last slide here with some information on how you can stay in touch with, if I can find it. Sorry, there it is. How you can stay in touch with us. So you are in, Martha, I think this is incorrect. So I will fix that. We will send out our speakers' information. You're welcome to use these QR codes to keep in touch with us here at the BRE Collaborative, and we are happy to connect you to our speakers. This webinar will be posted on our YouTube channel, so you can watch it again. And we will be hosting more of these measuring change webinars again next year. So if there are other topics that the attendees are particularly interested in, they are also welcome to email and let us know. So with that, I would just like to thank you both again so much. I know it was hard to pull together in the fall with everybody's busy schedules. And so I really appreciate you both taking the time out to join us today and share your experiences and your knowledge.
Thank you.
Thank you again.
Thank you for the opportunity.
Okay. I'm going to pause the recording.